right. Happy Thursday noon, everybody. This is Nina Ignaczak. I'm the founder and editor of Planet Detroit, and I am so excited for our final panel of our series today on our environment, our health, and how we eat. We did prior panels on where we live and what we're breathing, and now we're turning our attention to what we eat. And these are all topics that we report on regularly at Planet Detroit, and I'm really excited to have this panel with us today. I'm going to let each person just go around and introduce themselves and talk a little bit about the organization that they're a part of and how they're addressing issues of food and nutrition security in Detroit and Metro Detroit. So I will start with Amy Carras, who is with the Detroit Food Policy Council.
Thanks, Nina. Again, my name is Amy Carras. I'm with the Detroit Food Policy Council. I'm the Research and Policy Program Manager, and we are a 23-member council that has seats from all across the food system. So we have, for example, K-12, college, sustainability, agriculture, farmers markets. And though all of those people get together every other month around our table to talk about issues facing the food system and how we can collaborate to solve them. A lot of my work involves advocating for policy at the local, state, and federal level on all kinds of food access issues. And as an organization, we also support things like 10 cents a meal in our local fresh prescription program and those kind of things to just, and grocery store work and improving grocery stores and corner stores. And so helping these stores serve their customers better and have more fresh food available.
Okay, great. Thank you, Amy. And now I'm going to move to Jay Gerhardt, who has a very interesting program within the healthcare sector. Can you tell us a little bit about who you are and where you're from, Jay?
Yeah, absolutely. Thanks, Nina. My name is Jay Gerhardt. I am lucky enough to be able to serve as the manager of farm programs at the farm at Trinity Health Ann Arbor. Trinity Health has two farms. One's in Ann Arbor. One is in Pontiac. We call it the Oakland Hospital. So while neither are in Detroit specifically, I'm hoping that by presenting here today, other healthcare sectors, other healthcare providers can think about the way that we run our food and nutrition programming, and hopefully adopt some of the methods, or at least reach out to talk more about how healthcare can really influence the disproportionate access to healthy fruits and vegetables that we see in our communities today. The farm at Trinity Health runs a variety of programs. I will probably get into more of them later, but our anchor is addressing food and nutrition security within our community.
Okay, got it. Great. And then finally, Alex Kanipa. Sorry if I didn't pronounce it correctly. With Fair Food Network. Tell us about what Fair Food Network does and your work.
Sure. Hi, everybody. Alex Canepa. I'm with the Fair Food Network. We operate a program called Double Up Food Bucks, which matches EBT, what we used to call food stamp purchases, when they're spent on fresh fruits and vegetables at participating farmers markets and grocery stores. And we do that up to $20 a day. And it's a resource that we offer for food insecure folks to not have to make the agonizing choice between quality and quantity when they are shopping for groceries. And it's also a way that we can incentivize food retailers to serve food in places where there might not otherwise be a profit motive to do that. So we hear a lot about food deserts, and find that it's actually not always the case, that frequently there are places to buy food and beverages in low-income communities, just they don't have fresh fruits and vegetables. I remember a conversation I had with a grocer a few years ago, and I asked, why don't you have more fruits and vegetables? I was a little bit more polite than that, but and he said, I'll always make more money if there's pop in my refrigerators than if there's fruit. And Double Up is a program that works with grocers like that to try to tip the scales a little bit and encourage them by increasing the purchasing power that their shoppers have to buy those kinds of products. So it's lovely to be here today.
Thanks for coming. All right, I'm going to turn it back to Jay and ask you to take a step back and talk about why a healthcare system is getting involved in this issue of nutrition security, and then maybe a little bit more about the programs that you operate.
Great. Yeah, the quick and dirty is why not? But let's talk about the problem. The problem is that diet is the #1 cause of poor health in America. We also know that 600,000 people die a year from diet-related illnesses. These are preventable because they're diet related. Um, we also know that access to nutritious foods is disproportionately distributed to communities where folks with means often have more access to healthy, nutritious foods, and folks living in low income or poverty situations have much less access. Um, and lastly, we know that due to systemic racism, Black and Brown communities are often those that have that limited access to fresh and nutritious foods. So, um, thanks to years of research within the medical industry, we know that food has a dramatic impact on the health outcomes for those struggling with the diet related illnesses, diabetes, obesity, cardiac issues. We know that food and food access, healthy food access, is very important for the prenatal years. And we also know that food as medicine is very cost effective measure for treating diet related illnesses. We need drugs, we need prescription drugs for when people are really sick. But food as a preventative measure and food often as a treatment is very affordable. Therefore, hospitals and payers are really interested in food as an intervention to folks' health, um, as a way to treat our patients. So the farm at Trinity Health is sort of the food as medicine program for Trinity, Michigan. We have 2 sites, one in Ann Arbor, one in Oakland, as I mentioned. And all of our programming is focused on food access and nutrition, where we're actually giving out food through a program called the Farm Share. Folks are referred through the medical record often. And so their diagnosis can be tied to the food as the intervention to help alleviate some of those food needs and to get them more healthy food for their diagnosis. And in other ways, people find us and declare that they're food insecure, and we get them a free box of produce. We do fundraise for that program. I think a lot of people assume that because we're part of the hospital, like we just get bankrolled and get as much money as we want. That's not the case. We do have to be good stewards of our resources, and find that funding to cover that food. We're also providing education to the community, youth particularly. We're providing community events to kind of reduce social isolation, which is a cause of poor health. And we're donating food to clinics. We do a lot of smaller programs, but that farm share is our anchor, and our base and where we're going with the work that we're doing.
Can you kind of walk us through an example of somebody who may come to you with a diagnosis, and you mentioned the food is somehow related to it within their treatment plan or the diagnosis? How does that work? Can maybe like think of somebody who has diabetes or something. Like how would that happen?
Yeah, so a person could be in their be at the hospital being treated for diabetes. Their provider can ask them questions about their access to foods. There's these social indicators of health screening questions that everyone does at our hospital. And if they answer it in such a way that they are screened as food insecure, that provider can make a referral to us at the farm. I'm the
Mhm.
lucky one that gets to go into the medical record and receive these referrals, call the patient, talk about our program. And if they're a good fit and they want to do it, we sign them up and they start coming to the farm once a week for a box of 6 to 8 produce items. We also provide a ton of wraparound services. So we are providing recipes, cooking education, a free food pantry that they can visit. Again, a connection to a community health worker who can help them with their other social needs. We know that giving people just a box of food is not going to solve all of their problems. We also know that folks who are dealing with food insecurity are often dealing with some of these other social isms like housing instability, financial instability, paying medical bills, the gamut.
Mhm.
So that's how we operate, is through the medical record or through referrals on our website.
Got it. All right, I'm going to move over to Alex now. Tell us what this issue looks like from your perspective, and how Double Up Food Bucks works to try to address food insecurity and actually enhance the ability of people to access produce in their diets.
Sure. I think that the conversation around nutrition and hunger has changed a lot in the last half century. That the conversation used to just be about hunger, that it was seen as this binary where you were either hungry or you had enough to eat. And I remember, when I talked to my grandpa who's since passed, but grew up in the Great Depression, it was like an on-off switch. You were hungry or you weren't. And in
Mm,
the modern economy, with the types of food products that we have now, the service economy, just how the modern world is, it's less a binary between hungry and not hungry, and it's more of a three-dimensional nutrition hunger. It's a much more complex shape now.
yeah.
And we think of the problem less as food insecurity per se than nutrition insecurity. That in order to really be well, it's not just good enough to have access to 2,000 calories a day. It's
Mm,
what are those calories? Because frequently we find that there are people who have enough to eat, so no, they're not hungry, but they are malnourished because they just have access to simple carbs, white bread and pop and candy and the food that our technology and our economy has made very inexpensive. So what Double Up tries to do is to add a more nuanced approach to that conversation around how we feed ourselves by inserting nutrition security into the conversation and not just about hunger. So
mhm,
when the SNAP program, when food stamps were created in the 1970s, it was very much it's an anti-hunger program that you get resources that you can use to buy food. And one of the reasons why the program is able to be so comprehensive and offered in so many places, farmers markets, grocery stores, bodegas, is that you can use it on, you can't use it on alcohol, you can't use it on tobacco, but other than that, pretty much everything else is fair game. You can buy soda with it, you can buy candy. And so there's not a mechanism built into the SNAP program to make it a inherently nutrition security intervention. And
mhm,
so what we view as a potential solution, or one of the solutions that we're working on at the Fair Food Network, is to insert nutrition security into the SNAP program by offering this supplemental incentive. And
mhm,
so it's not a replacement for SNAP at all. We are always going to need SNAP as the bedrock security for anti-hunger in the United States, but we think that it can be improved and enhanced by programs like Double Up that provide even more resources and more of a nudge for both recipients of those benefits and retailers to make more nutritious purchases. So I think that that's from my vantage point and from the Fair Food Network, how we see our role. And it's a pretty, it's just one corner of the food system, but that's how we think that we can make a difference.
And you mentioned that, you're able to offer this in a lot of places. The program has really grown, but you've also faced some headwinds. Can you talk a little bit about the growth and the expansion
Sure.
of the program? Where is it available now?
We started in Detroit in 2009, and
Mm,
since then we've grown to 235 sites in the state of Michigan and 66 of Michigan's 83 counties. And last year we served 211,000 households in the state. We were able to grow through a mixture of philanthropic support, investment from the state legislature, and investment from the federal government through a program in the Farm Bill
mhm,
administered by the U.S. Department of Agriculture called the Gus Schumann incentive. Something that the headwinds that you referred to, a lot of them have to do with funding. So the way that the SNAP program is funded is all of the benefits, every cent that recipients use to purchase food is paid for by the federal government. And the way that the funding mechanism works is it's essentially on autopilot. So if you qualify for, so let's say that, we saw this during COVID, all of a sudden in 1 year, twice as many people qualify for SNAP. Congress doesn't have to go in and double the program's budget. Its budget fluctuates based on who qualifies. The programs that we run function differently, where we have to fundraise for the cost of the food, just like Jay does, and the program administration. So when COVID caused our use to increase by 212% in 18 months, that our funding didn't automatically increase by 212%
Right.
in months.
Yeah.
So we were unfortunately forced to pause double up earning for 6 months at the end of 2022 because the supply and demand of people trying to use these benefits and the funding that we had available were such that in order to safeguard the program's long-term security, we had to pause temporarily benefit earning. So the way, to answer your question, the way that the program is funded is clunky and it's not responsive to quick changes in demand that we've seen. And so it's a testament to the work that our development department has done in the last decade and to the advocates, both the state and federal level, to encourage those legislative bodies to invest in the program.
Is a future hope that this will become more tightly integrated into government operations, or does it really need to operate independently to remain responsive?
I don't think so. There are some states where the state government itself is who manages the SNAP incentive program. So some states like Washington State do a great job, and their state health department is the one that manages the program. In some states like Michigan, it's an NGO, it's a nonprofit like ours that manages it, working closely with the state government. So there are programs that are really successful that are operated by government employees, and then there are programs that are really successful that are operated by people who work for organizations outside of government. I do think that if these kinds of programs are going to be sustainable at scale, the funding mechanism has to become more sophisticated and more in line with the overall SNAP program.
Got it. Okay, Amy, I'm gonna finally get to you. Sorry. All of your work is so interesting. Amy, I know you've been involved with the Detroit Food Policy Council for a long time, and you've seen a lot of evolution in the local food landscape over that time. Tell us about the bright spots that you're seeing. Oh, you are muted.
Sorry, that seems to be my signature move for today. I like that question because while there are a lot of challenges in the food system, we also have a lot of strengths, particularly I just came off of a strategic planning session with a lot of our council members before I came here, so I'm really just excited about hearing everything everyone does. But one of the things that I think is great is there's so much creativity and so much collaboration. So there are people doing all kinds of creative things. Like it wasn't an accident that Fair Food Network piloted Double Up Food Bucks in Detroit because we have such a robust system of collaboration and also a population of people who would really benefit from it and are very enthusiastic about it. So some of the bright spots more recently are the city of Detroit just hired its first director of urban agriculture, which was very exciting. It's something that advocates have been asking for a long time. And in my opinion, could not have picked a better person to do it. Tefira Rushton has been a very valued person in the Detroit food scene for an extremely long time. She's very knowledgeable. She's very trusted by just about everybody. And so that was a really exciting thing to have happen. We have been working with the city on our livestock ordinance. This has been something that I've been working on since I started at DFPC in 2016, and it's kind of been more active and less active over the years, but we're getting closer to getting that passed. In many ways, the pandemic made proof of concept for a lot of things that food advocates have been asking for a long time. For example, the expansion of SNAP eligibility, that led a lot of people to take up SNAP that hadn't previously done so. And that showed that if you give people more money, they're going to make better food choices. Almost everyone reported that they were eating more fresh fruits and vegetables. They were trying foods their family hadn't tried before. So things like that, I think are really important that we're showing that if you actually fund this more generously, people are going to make better choices. If you, or I should say healthier choices. If you, for example, there was a lot of funding all of a sudden to just get food into the hands of people. So they were giving things to people like Eastern Market, who are really good about getting food into the hands of people who don't have access. So free school lunches, we have that in Michigan now because there was that proof of concept over the pandemic where all schools did it. And then we found out that that was really beneficial for kids. So I feel that there's a lot of progress being made. There are a lot of things that we've been asking for a long time that were tried during the pandemic and that we've been able to say, see, this was beneficial. This did help people.
Got it. And tell us a little bit about maybe some of the things that you're still working on, still trying to get to. Yeah.
Well, we're still trying to get this livestock ordinance passed. It has been
Tell us about, well, I'll ask you a little later about more detail on that, but what else are you working on that's not quite where you want to see it at this point?
Yeah, definitely. I would say one thing in particular is our grocery store work. We've been working with Wayne State University and other partners, including Fair Food Network, for many years now to build community relationships with grocery store owners, to encourage them to do things to welcome in the community and to really create those relationships so that when, if there's something the community wants to see, if they feel like they're not being well treated, if they don't like the offerings, they have a relationship with the store owner to be able to go in and say, hey, we don't like this, you need to change it, and be responsive to us. So, and if you do that, we will shop at your store more. So that is something we've been working on that for a long time. We work with Wayne State to create a list of 25 great grocers, which are people who, there's a measure called the NEMS that checks the different boxes of like things that are available in the local store. So and those scores have improved over the time that we've been doing it. So
What are some of those things that you want to see available in the
sure,
NEMS?
there's things like,
Examples?
fruits, vegetables, lean meats, just kind of general healthy options.
Mhm.
So, and that's gotten better over the time that we've done that. And then we publicize those stores, we give them banners, we give them stickers, we publicize this in the media so that we're lauding grocery stores who do it well and kind of raising the bar for everyone. Another thing that we've been working on is the Healthy Corner Store Initiative, which is we go into, with Wayne State Medical School, we partner with local party stores, basically, that are WIC retailers, and we're encouraging them to have more fresh food in their stores. So the way that goes about is we do health screenings through the medical students, and and then we'll have a volunteer go in and shop with them to show them all. We have some healthy recipe cards, and we go in and shop with them and show them what they can find that are healthier choices, even within their party store. So if they're dealing with transportation challenges, a lot of Detroiters work multiple jobs to stay afloat. So if they're dealing with time challenges, anything like that, they can just know that they can walk down to their local store and have something wholesome to eat. That is a program. There's definitely a lot of room for growth there. We've been doing that for a couple of years. We'd like to have more stores participating and more stores being really active partners in that in terms of allowing more, having more fresh fruits and vegetables in the stores. It's been really well received by community, but we really, that's an area of growth, is to be able to grow that program more and work a lot more collaboratively with the store owners.
So, Alex brought up the topic, but I want to ask you, I think we've all heard the term food desert, and then there's questions about whether it's a legitimate concept or it's just kind of something that uh, is misunderstood. Where are we in terms of access to quality grocery stores? Do we have a measurement for that? Do we know where we want to be and where we are now?
Yeah, we do have a measure for that. We actually track that in our Detroit Food Metrics report, and particularly over the pandemic. So one thing that a lot of people don't realize is that grocery stores run on an extremely tight margin, like 1% to 2%. So if there is any kind of disruption, that can cause stores to close. So we've lost, probably in the years that we've been doing this, we've lost 5 or 6 stores. But then the bright spot of that is that community is responding to that need. So now there have been a couple of different people who've opened up small but full service grocery stores in their communities that, one person, his business is called Neighborhood Grocery, and he's been crowdfunding for that for several years, and it just opened this year. We also have the
Right.
Detroit People's Food Co-op that's coming, that'll be open later this spring, that we're very excited about. So things are improving. Things are definitely getting better. And what's so interesting to me is that as much attention as like Whole Foods and Meijer got when they moved back into the city, what we're really seeing in terms of lasting solution is coming from the community.
Got it. Okay. So Jay, I'm gonna go back to you. I want to talk about how we track impact and how and sort of where we are in terms of understanding the needs and the impacts that we're having in these programs. So how does the farm track impact on patients' health that you enroll in these programs?
Yeah. So the farm share assistance program, which is the one that I was talking about, started in 2018. And since that time, we've been tracking, we've been using surveys for patients, what we call them members, to self-declare how the farm share has had an impact on their health. So we're not measuring biometrics or A1C levels or anything like that. It's a self-declared impact. So we are seeing that folks are eating more meals at home. Their children are requesting more fruits and vegetables. Um, their access to healthy and nutritious food goes up, not only because we're providing a farm share box for 36 weeks out of the year for free for them, but that frees up their budget to then go buy other nutritious, healthy foods at their grocery stores, or spend that money on their other social needs. So we're seeing this like overall positive impact on folks' health and well-being. We received a grant this year that we will use throughout the season to look more at health outcomes for patients. We know that sustainably over the long term, we need more sustainable funding. Right now we're chasing grants. And the place to get sustainable funding in healthcare is through Medicaid and through payers. And so we need our program to prove that one, our intervention, i.e., these vegetable boxes, have a positive impact on people's health, and that they reduce healthcare costs, because that's what those payers care about. So so we are working on that research. We're working within our hospital with partners to identify specific patient populations like perinatal patients, diabetic patients, that we can then give them that intervention, gather some of that more biometric data, and then make the case for more sustained funding and reimbursements ultimately.
Are payers paying attention to this? Have any come on board at any level or in other healthcare systems? Can you tell us sort of about how far we are down that road?
Yeah, they're absolutely paying attention. And in some states, they have these Medicaid 1115 waivers that do allow for that reimbursement. Michigan, we're on the fence. We're hopefully going to get there very soon. And also, some of these payers are funding the research for which to tell this story. So Blue Cross Network, Blue Care Network, Blue Cross Blue Shield Michigan, they are funding. Michigan Health Fund has put some dollars towards our studies. We just applied for in the federal world, we just applied for the Gus Shoemaker, as Alex mentioned, that GusNIP nutrition incentive. We applied for a produce prescription grant yesterday. So yes, woohoo, got it across the finish line. So yeah, that's the ultimate goal.
Is to get the payers to pay for it.
Exactly. Yeah.
Right.
To prove that it has impact, to prove that it's going to save money in our healthcare system, and then therefore to have them pay for it.
And so I guess that brings me then back to Alex. Even better than having, a payer pay for something because somebody has a disease and now, we're looking for nutrition, is to have that nutrition in the first place and hopefully prevent the disease from happening. So To what extent are, are programs like Double Up Food Box able to show that they're having that preventative effect? Or if not, maybe what needs to kind of happen to understand the impact of this produce?
One feature of the SNAP program is that it is not embedded in primary care. So when you apply for SNAP benefits, you don't have to go to the doctor first. They don't make you get on a scale. They don't take your A1C levels, and that's a good thing. Because if
Right.
it did, it would be a lot harder for people to enroll in this program. It's one of the last vestiges of the welfare state that survived welfare reform in the 1990s. And so it is not a medical program at all.
Mhm.
And because of that, Double Up doesn't collect any medical data from the people that use the program. That's not what the program is. It's not what it's ever been about. It's predicated on there's lots and lots and lots of there have been more medical studies about what is good for us to eat than it's
You
possible
know
to
that.
cite
Yeah.
in no, but we know that fruits and vegetables are good. So
Yeah.
that's good enough for us. That if we can get people to eat more fruits and vegetables, that's the impact we're trying to get. And we'll let the researchers and people with all the degrees figure out how much it can save in the healthcare system and what the sort of tangible benefits are. One thing I will say is that there have been two studies done in the last few years, one by our external evaluator in Michigan, which is the University of Michigan, and one done by the Gretchen Swanson Center for Nutrition in Nebraska, which found that participants in Double Up Food Bucks don't just eat more fruits and vegetables than the average SNAP recipient. They eat more fruits and vegetables than the average American and the average Michigan resident, which is us. So
Wow. Yeah,
that
not
is, I mean, truth be told, that's good enough for us. I mean, if it is having the desired effect of getting people to eat more fruits and vegetables, that's cool. We'll let the public health people study everything else, but that's what we've been really proud to hang our hat on last year.
got it. Yeah, that makes a lot of sense. Amy, what about in terms of Food Policy Council? What you mentioned the metrics report. What are some of the really key metrics that you're tracking that either you're proud of or that show the difficulties that we're continuing to face?
Yeah, I mean, one of the big ones is we do track um, things like school meals. That is one that we're proud of because there's been increasing uptake with that. We've been a community eligibility site for many, many years. And so that's another way to kind of prove the need for school meals. Another thing that, some of the other key metrics, again, grocery stores, that has been a mixed bag because, well, kind of more traditional independent stores are closing. There, we are seeing all these new community-based stores opening up, which is a great thing. But the overall, I don't know the statistic off the top of my head, but there's to not be a food desert, to make sure that the food needs are met in the community, we would need something like 85 stores because there's a like X number of stores per 1,000 people that you need to have.
How many are we
We
short then? It's like 30 some?
No, we're not quite short 30. I believe we're short about, depending on what year it's been, we're probably short about 10 to 15.
Oh, okay.
Yeah.
Mhm.
So, but as stores continue to close, that metric becomes a little bit more.
Fluctuates. Yeah.
So that's something of an issue. Um, we do look a little bit at cardiovascular disease, which tends to stay very steady. One thing that we've seen go way up in the wake of the pandemic is food insecurity. That is really challenging, and really difficult. And what I hear from some of my colleagues in emergency food, so people providing direct food assistance to people, is that the spike went up at the beginning of the pandemic and it just has never come back down.
Yeah.
So,
Because
that
of inflation, do we think, or why do we think that is?
I think it's inflation. I think it's job loss. I think it's wage growth not keeping up with
Yeah.
increases in cost of everything, not just food, but housing, automotive, everything is just so much more expensive than it used to be. So having, so I think that has a lot to do with it. Is just this, um, I feel like there's sort of this hidden suffering that we're not necessarily seeing in the middle of a booming economy, but that is definitely happening. Um, so that has been a pretty consistent problem. And has gotten worse since the pandemic. So, those are some of the things that we're looking at. We also look at SNAP uptake, how many people are eligible for SNAP and how many people take it up. And that number has ticked up a little bit, which is a good thing, so that if there are people that are eligible, that they're actually seeing benefit in using their SNAP benefits and helping improve their family's food security.
Got it. So I'm gonna wrap up by asking each of you just to weigh in on the future, and if you could sort of, wave your magic wand to get where we need to be within like 5 years, what you'd want to see happen. But as I do that, we're gonna leave some time for audience questions, and I believe you just can type them in the chat, and I think they will get to me. Um, so please post any questions or comments that you want to make in the chat. And then Jay, I'll start with you. What are you hoping to see happen, change to address this issue and really move the needle in the next, 3 to 5 years?
Yeah, I mean, ultimately, it'd be great if no one was referred to us, that everyone was healthy, no one had food insecurity. That's very unlikely to happen. And so, in the meantime, I think we are limited only by funding. We have the infrastructure, we have the staff, we have the willpower of the hospital. But healthcare also has suffered after the pandemic. And so there's not a lot of even healthcare resources within our hospital to go around. So, as I was saying, more sustained funding for our programs, more integration with the healthcare system, so that we can reach more patients. We we want, and we also want to prevent folks from going to the hospital. So anything we can do to bring more people in is where we want to go.
Okay. And Alex, what do you want to see happen in the next 3 to 5 years within your program or within, our larger?
I'd like to see the parameters and the frames of reference for how politicians talk about nutrition policy changing. I've done this work now for 12 years. This is my third farm bill, and it's the same conversation. It's like Groundhog Day, that in Washington, D.C., it is food stamps good, food stamps bad, more money for food stamps, less money for food stamps. And that's basically the extent of it from a partisan standpoint. But I talk to a lot of politicians as part of my job. Some of them are very conservative, some are very progressive. And they all, when you get them one-on-one, get this. The most fiscally conservative politicians that I meet with understand that it is in the best interests of Michigan and the United States for people not to have diabetes. And that one good way of doing that is making it easier to buy fruits and vegetables. And everyone wants to see farmers make more money. Everyone wants to see us be more healthy. Everyone wants us to spend less money through costly healthcare interventions, bariatric surgery, Ozempic now, insulin. It costs a fortune. It's heartbreaking. Nobody wants that. So I think that our political system there's so much gridlock and there's so much anxiety on both the left and the right to step forward and say, all right, let's totally change the way we talk about this. Republicans step forward and say, all right, maybe we should spend more money on this nutrition thing because it'll save us money down the road. And, maybe Democrats should step up and say, all right, let's find out a way to make this more efficient. So maybe we can save more money. Maybe there are places we can find savings so that we can make this whole system work better. So I think that I wish that we could just shake the political dialogue such that some stuff kind of gets knocked out so that we can just have brave conversations that aren't being had, and everybody feel liberated to to entertain ideas that they might have reflexive aversion to, or a perception, oh, my party won't like it if I say this, because in private they agree. So it's just about getting them to agree in public. And I think that if I could change one thing, it's more at the federal level, to be honest, than at the state level, that we just start being honest and creative and brave with how politicians discuss issues having to do with nutrition.
Very interesting. All right. I'm gonna go to Amy last, but I'm gonna mention that I'm not seeing any questions. So that could mean that there are no questions, but it could also mean that I can't see the questions. So Monica, could you just double check on that for me as Amy is telling us what you want to see happen in the next 3 to 5 years? What's going to really move the needle for Detroit's local food policy?
Yeah, I think there's a couple of things that we will be able to move the needle on and that are already moving. For example, we are, because we have someone who specializes in urban agriculture in the city, we have an inroad now to be able to have the city really appreciate the impact that urban agriculture has had, both in the revitalization of the city and our ongoing food security, and in just building community. So I would like to see more of that, more of that continue, that the role of urban farms and urban agriculture in our city is recognized and celebrated. We would like to see, this grocery store work continue to do well, and the corner store work continue to thrive, be able to have that more widespread across the city of Detroit. And so that everyone, no matter where they're shopping or where they live or what their economic situation is or their neighborhood, can walk to a store and buy, some fruit and maybe a salad to in an affordable way that is something that is actually going to work for them, is something that they're going to enjoy, that they feel comfortable doing, and that they know that they can reliably find that in their local stores. We would like to continue to see the expansion of school meals. It's been very successful here. So we would like to see that happening throughout the state and expanding to even to charter schools, so that something like 40% of Detroit school kids do not attend DPSCD. They attend charter schools, so that those kids can also have access to healthy and nutritious meals at school. So those are the kind of things. So basically more of what we're already doing and more of it, and that there's just continued support for some of these creative ideas that people are coming up with, like crowdfunding a neighborhood grocery store, like finding ways to process food so it's easier for seniors, which is also a project that we've worked on. So, those kind of things, just that creativity and just recognition of how important food is in the life of the city.
Great. All right, we do have one question. This is something I think for Alex. Gibran wants to know, are there any plans to offer double up in smaller neighborhood or more non-traditional food sites like urban farm stands or food distribution hubs?
Yes, we already offer double up at a few farm stands. So like Oakland Avenue Urban Farm Stand is a great one that just pops into my head, and I know that there are many others. Flint Mobile Market is one up in Flint. So absolutely, it's not just for brick and mortar grocery stores, farmers markets, and food. Yeah. So to answer your question, is absolutely there is, and if you'd like to learn more about it, please reach out to us, and we'll give you more information.
All right, great. And we will follow up with an email with everybody's contact info too, so that they can do that. Any more questions? I have one more question. So hopefully folks will come up with a few more, but Amy, tell us about this livestock ordinance. What are we talking about here? And why is it I assume you were an advocate of it, so tell us why it's something that we should have in the city.
Well, in short, in large part, it's because there are already people raising livestock in the city. There are a lot of them. If any of you said to me, hey, can you introduce me to suburban chickens? I would have lots of places to take you. But, it's good for food security for the community. So, during the pandemic, it was very common for people who were raising, let's say, some backyard chickens to make sure that their neighbors, instead of having to go to the store and paying $7 a dozen for eggs, if they could find them, have a couple of eggs from their neighbors' chickens. That kind of ability to share bounty with your neighbors and create your food security for your own family is really important. To not go way too far into the backstory of this, but this ordinance in 2013, when we passed an urban agriculture ordinance, originally some rules around animal keeping were part of that. That got taken out just to kind of ease passage of the urban farm ordinance. And so over the years, advocates and one of our founding members is with the legislative policy division of the city council. So she was really a strong advocate for that within the city. They've been working to make this ordinance happen so that it protects both neighbors and it protects people who are keeping animals. So there are standards that they have to meet. There are in terms of even like zoning and setbacks and things like that, but then also so that people people who have the animals are protected if their neighbor's angry about something that they're doing, as long as they're following the rules. And neighbors are protected if they have a neighbor who's not following the rules. There's an actual ordinance violation that they're committing that can be enforced either through animal control or zoning, as the case may be. The ordinance in a current form, we had goats in there in the last go round. We took them out this time. It's really just for chickens, ducks, and bees. People get a limited amount that they can have on a single family lot. Urban farms and gardens can have more. And another, again, creative idea that we're working on is the formation of a livestock guild. So to take all of these people who have been raising animals for a long time, do it very successfully, and pay them to offer training to would-be animal keepers. So if you want to, have some chickens, you would go and take this class from somebody who's already been doing it in the urban context very successfully, knows where you can find vets and bedding and people to build coops and all of that stuff, and have those people train the people and do a little bit of mentoring as well. So if somebody isn't doing what they're supposed to do and there's a complaint, the guild can come and sort of mentor that person and help them figure out how, given their restrictions, that they can find ways to do this successfully. And so these have all been really, this has been a really well thought ordinance. This last go round's been in the pipeline for about 2 years. And we are finally at the planning commission level. We had a hearing last week and we're hoping to get a vote next week. So, hopefully this will continue moving forward and allow animal keepers to do what they're doing, like out in the open, and be able to do it in a way that benefits the community.
Okay, great, thanks. And one last question for Jay. Gibran also wants to know if you have a template or framework on your program that collaborative of organizations might use to get started.
We've been asked quite a bit from hospitals for some sort of a playbook for them to create this kind of farm at their hospital site or healthcare organization. We have not written a playbook. I'd say visiting our website is the best to just learn more about what we do, and that's trinityhealthmichigan.org/the-farm. I bet a Google search would also get you there. But I want to stress that, it takes money to start these things. The farm that we are on was started in 2010. And I think at the time, the leaders were really forward thinking and like creating these food as medicine programs in 2010. It was not part of the conversation then, but I don't think they realized how much resource it's going to take. And so our development office has been very critical in helping us to grow to the kind of state that we're in right now. I would say we're looking at like, how do we reach a broader community? Because we've already created the resource. We have the food hub, we have the coolers, we have the staff. How do we get more of food shares out to the community through delivery, through coordination with other hospitals like Michigan Medicine for, they're all merged now. So Beaumont, Corewell. So often when we're asked for this playbook, we say, it's not as easy as it looks, and it takes a lot more funding than it looks like. So, but it really does take the will of hospital leadership to create that, the initial funding and the initial resources to get started.
No, I did it because my dog was barking, so I'm back. I just wanted to say thanks to all of you. I don't think we have any more questions. So I think we'll wrap up and give everybody 10 minutes back. But thank you so much for this conversation today. We really appreciate your time.
Thank you, everyone.
Yep.
All right.
Bye.
Wonderful Thursday.